heart transplant is a life saving procedure performed when a patient's heart reaches the final stage of failure or suffers from severe coronary artery disease. When all other treatments fail, a new heart becomes the only hope. This intricate process involves replacing the diseased heart with a healthy donor heart through a complex surgical procedure. India has witnessed significant progress in heart transplants over the years. Data from the National Organ and Tissue Transplant Organization shows an increase from just 30 heart transplants in 2013 to 243 in 2022. Despite this progress, challenges remain, making the process of saving lives far from simple. So, what's the biggest hurdle? The scarcity of donor hearts. India's organ donation rate is alarmingly low, just 0.52 donors per million people. Cultural taboos, religious beliefs, and lack of awareness contribute to this crisis. Family often struggles with the decision to donate organs after brain death, making it even harder for critically ill patients to find a match. Even when a donor heart is available, the challenge doesn't end there. Heart transplants require advanced medical infrastructure, and only a handful of hospitals in the country are equipped for such procedures. Transporting a heart within the critical 4 to 6 hour window is a race against time, often hindered by inadequate logistics. Most transplant centers are concentrated in metro cities, leaving rural patients with little hope. Then comes the financial burden. The cost of a heart transplant in India ranges between 15 to 25 lakhs, a sum that remains out of reach for many. Even if a transplant is successful, the cost doesn't end there. Post operative medication alone can cost 30 to 50,000 per month for life. Limited insurance coverage adds to the woes of families desperate to save their loved ones. Despite medical advancements, risks remain high. Organ rejection is a major concern, even with immunosuppressive drugs. The shortage of skilled transplant surgeons, genetic mismatches, and post operative complications pose additional hurdles. Ethical concerns also loom large, from illegal organ trade to inconsistencies in the implementation of the Transplantation of Human Organs and Tissues Act. Yet, amidst these challenges, success stories continue to emerge. AIMS Bhopal recently scripted history by performing the state's first ever heart transplant, offering new life to a 53-year-old patient. Similarly, 19-year-old Aisha from Pakistan underwent a heart transplant in Chennai, and within days she was off life support, proving that transplants can indeed be a second chance to life.
A heart transplant is a race against time and challenges. With medical progress, the question remains, are we ready to be organ donors? Because sometimes the gift of life is just a heartbeat away. Harshita Oberoi reporting for Wellness Watch, DD India.